Good morning friends, welcome on my channel Charming Science. Today we are going to talk about the bone triquetrum. So when we are going to talk about the triquetrum is one of the 8 carpal bones of the hand. It's having a three-faced bone found within the proximal row of carpal bones. The triquetral bone, also known as the triquetrum pyramidal bone, it is a wedge-shaped carpal bone having a three-faced and formerly known as the cuneiform bone, located in the wrist on the medial side of the proximal row of the carpal between the lunate and the pisiform bone. So when we are going to see the triquetrum location, we will find that it lies toward the medial side of the hand in the proximal row of the carpal bones between the lunate and the pisiform. It is connected to and articulate with the ulna through the triangular fibrocartilaginous disc-like structure here present, where it's going to connect with the ulna and form a ulnocarpal joints capsule. It can also connect with the pisiform, hamate and lunate bone. When we are going to talk about the function of the triquetrum bone is a unit to provide a suprastructure or the bony suprastructure of the hand or the wrist. When we are going to talk about the surfaces of the triquetrum, we will find that the superior surface presents a medial rough non-articular portion and a lateral convex articular portion which articulate with the triangular articular disc of the wrist. When we talk about the inferior surfaces, the directed lateral ward, it is a concave and smooth articulation with the hamate. This is a place for the articulation with the hamate. So this one is the inferior surface. The superior surface lies toward approx this area, which we are not able to see in this image. But the inferior surface is a directed lateral ward, concave structure, and having a smooth articulation for the hamate bone or the another hamate carpal bones. The dorsal surface is rough for the attachment for the ligaments. The volar surface or the palmar surface present on its medial part having an oval facet. This is the palmar surface. So it's having an oval surfaces for the articulation with the pisiform bone. The lateral surface, the base of the pyramid is marked by a flat quadrilateral facet for the articulation with the lunate. And the medial surfaces is pointed and roughened for the attachment of the ulnar collateral ligaments. So when we are going to see the image in this view, we will find that if I will make it a large enough, the superior surfaces, when we are going to see this is the palmar surface, palmar, this is the dorsal one, and this is the oblique one. So if we see the dorsal surface, this one is the triquetrum on the palmar surface, this one is the triquetrum bone which is present. So when we look into it, if we see below, when we will see the palmar view of the surfaces, we will find that its medial part having an oval facet. So when we look into it, it's having an oval facet onto the palmar side toward the medial side. On the palmar surface toward the medial side, there is having an oval facet which articulate with the pisiform bone. When we look onto the dorsal surfaces, we find there is having a rough alignment which for the ligamentous attachment. There is having a quadrilateral articulation for the bone, or the articulation with for the another bone, that is the lunate. When we talk about the muscular attachment on this, so we will say that there is not having any muscular attachment present on it. It's having the ligamentous attachment present on it, that is lienotriquetral ligament, triangular fibrocartilage complex, or we say TFCC complex, ulnotriquetral ligament, ulnar collateral ligament, meniscal homologous ligament. When we talk about this arterial supply, then we will say that it get blood supply from a network of nutrients vessels. When we talk about its ossification, it begin to ossify at the 3 years and completed by 6 or the 7 year of age. That's all for the triquetral bone. Thank you.